We'll be discussing today Obamacare, or the Patient Protection and Affordable Care Act, as it applies to individuals or those who are self-employed. PPACA has the stated goal to reduce the number of people who didn't have insurance and won't have insurance. As of last year, that number was about 50 million Americans. The goal is to get that number down to 30 this year and 20 by the end of 2014. The mandate requires all individuals to be covered by insurance starting January 1st, 2014, which you have to have the insurance in place by the 31st of March. If you don't have the insurance, you will be subject to a penalty, which is either $95 or the greater of 1% of your adjusted gross income. Those penalties increase each year for the next 2 years. Employers, starting 2015, will have to provide insurance to their employees if they have more than 50 full-time employees, or the equivalent thereof. In the meantime, there is a public marketplace exchange that only works right now for individuals. There are ways around it for corporations, but you can find that out on my other presentation. This marketplace lets you find and choose insurances that you can compare them for the first time by looking at various basket cases of events to know what is or is not covered. If you wish to be covered by the 1st of January, you must be enrolled by the 23rd of December. And the open enrollment season will expire on the 31st of March. And that means if you didn't insure yourself, you will have to go to the public exchange, i.e. the marketplace, an insurance broker, or something along that event, or be subject to a qualifying event. A qualifying event is when you get married, when you get divorced, you have a baby, or you lost your job. Every single American citizen or legal immigrant must have the minimum essential coverage, the MEC, have a legal exemption, or will be subject to that $95 or 1% shared responsibility payment. Your children or your dependents aren't liable for that shared responsibility payment, but if you don't get them insurance, you are liable for that penalty. The minimum essential coverage includes things like your employer insurance, which includes COBRA that goes on for 18 months if you lost your job, or retiree coverage. Any insurance coverage that you bought MEC-based benefits from on the individual marketplace, or any plan that you buy in the federal or state-approved marketplaces. If you're covered by Medicare or Medicare Advantage, you're exempt. Or not exempt, but you're covered by the MEC. If you're covered by Medicaid and your children are covered by CHIP, you have the minimum essential coverage. And TRICARE and some veterans insurances cover you for those. How do you get an exemption? It's not as easy as you think. You need to be a member of a religious sect that has been recognized by the IRS to be one that opposes insurance benefits. You can't start your own religion. You can be a member of a recognized healthcare sharing ministry, or a member of a federally recognized Indian tribe. There are other exemptions. If you did not make sufficient money that you are subject to the Internal Revenue Service Code, and that changes each year, but it means you didn't make virtually any money, and you have no filing requirement, you're not required to purchase insurance. You'd be a fool not to get Medicare, however. If you had a short coverage gap of less than 3 months, you won't be hit with the penalty. If you suffered a hardship, if you don't have access to affordable coverage, you were in jail, or you weren't lawfully present in the United States, even if you were a citizen, you don't need to get MEC. So what does a self-employed individual do? You can obtain minimum qualifying insurance, the minimum coverage to avoid the penalty, by going to the health insurance marketplace at healthcare.gov. You can be covered by an employer-sponsored plan. We offer them to our employees and to other people who work with us as independent consultants in one of our ventures, or you can get covered by your spouse or your parents' employment plan. You can have a government-sponsored plan such as Medicaid, or purchase a regular plan from an insurance broker that meets the MEC requirement. The marketplace is intended to be a competitive online insurance shop. The concept lets you compare and contrast various insurances. If you have a company, you will not be required to go on the exchange until November of 2014 for 2015. Some of the states have their own marketplaces, and the goal here is to get everybody to get insurance, because in so doing we have one large pool. Those sicker Americans, their costs can be spread across the entire population of insureds. If you think that's bad, just remember all the people that aren't insured now and weren't insured in the past. We're adding to the burden of your health care costs, either through insurance or visiting the hospital or your doctor, because somebody had to pay it and we just added it onto your bill. There are 5 plans, but basically only 4. They're based upon the percentage of costs they cover and their actuarially value. The cheapest plan you can buy, unless you're under 30, is the Bronze plan. It has a $5,000 deductible typically, but it does have a 30% co-insurance. Your maximum out-of-pocket on all the plans is $6,350. The Silver plan has a typical deductible of about $2,000, but the co-insurance is going to be 20%. That means you pay 20% of the reasonable and customary events and the same out-of-pocket maximum. A Gold plan has a deductible of $0, but it has co-insurance of 20%, so your out-of-pocket is $6,350 again, and the Platinum has a co-insurance of 10%. If you're under 30 years old, you have the right to buy a catastrophic plan, which means that you will pay for all your health care costs up until you pay $6,350. And then you're capped. Now, if you're self-employed and you make between 100 and 400% of the poverty level, you may be available to obtain the premium tax credit. You can get that in one of 2 ways. You can get it in advance, or you can get it after you file. But to be eligible for the PTC, you must enroll in coverage through the health insurance marketplace. There's no way around it. You have to be a U.S. citizen or possess a legal immigration status. You cannot be incarcerated. You also don't need to have insurance if you're incarcerated. You cannot be claimed as a dependent by another individual. As I said before, if you are claimed as an dependent or you have dependents, the person claiming you is subject to making sure you have insurance. And if you're married, you must file a joint tax return. You cannot file married filing singly and get the premium tax credit. The PPACA subsidies, as I said, can come 2 ways. Get it later or get it now. If you get it later, that means you're going to wait till you file your taxes and obtain the credit at that time. You pay the full and complete premium in a timely fashion to the insurance company, and your PTC is determined after you filed your taxes, and it's based upon the actual adjusted gross income for the family, or an individual if you're not married. The Get It Now actually has 2 different versions. You can get all of the PTC based upon what you think your adjusted gross income is going to be, or you can get a portion of it. I suggest you get a portion, maybe even a big portion, depends upon how good you feel about your estimates, so that you're not subject to paying back any PTC you obtained that was based upon the wrong adjusted gross income. The PTC that you claim on the advanced portion will be adjusted up or down based upon your 2 tax filings. As I said before, the tax credit is available if your household income is between 100 and 400% of the poverty line. But if you don't need a subsidy, you can buy any compliant insurance plan you want directly from the health insurance marketplace or via an insurance broker. And your private individual plan premiums, if you're self-employed, could be deductible as long as it doesn't exceed 7.5% of your adjusted gross income. So what are your next steps? You can head over directly to healthcare.gov, which will funnel you to your state site if your state's running their own, or keep you on the federal site. Don't go looking for state sites, in my mind, because they're subject to spam and you can end up being on the wrong place and giving the wrong information and getting in all kinds of trouble. I suggest you go to healthcare.gov and then let them funnel you to your state site. Alternatively, you can choose either of the two links I have here, which can't be manipulated, and they'll get you to a site where you can get conventional insurance or the PPACA approved plans. Thanks for listening, and remember, the 23rd of December means you will be covered by 1 January if you enroll, otherwise by March 31st of 2014. Thanks for listening.